Well, we will call the Health and Human Services meeting to order. Madam Clerk, roll call.
Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Present.
Commissioner Colleen.
Well, I'm here, but about 10 minutes ago, we got the announcement to evacuate the building for the Guardian because of a fire. And then 4 or 5 minutes after that, they came on and said, no big deal. So I just made it back into my office. I'm here.
Commissioner Baker McCormick.
I am here as well.
Present.
All right, well, it's good there's no fire. Next item.
B, Chairwoman's remarks.
As I said, it's good there's no fire and everybody's okay. All right, next item, please.
C, approval of the January 11, 2022 meeting minutes.
So
There.
moved, Anderson.
Clean support.
Thank you. It's been moved and supported. All those in favor?
Aye.
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 Thank you. Motion passed. Next item, please.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, communication from Carol Osterberry, Director of Health, Human and Veteran Services Department, Public Health Division, forwarding a report on the Michigan Department of Health and Human Services Local Stabilization Authority funding.
So what we're gonna do is we'll take all of the items together. I think it's 1 through 5, and we'll discuss each item. So is there someone from the administration to discuss item 1?
Yes, Jennifer Floyd, Dr. Floyd.
Thank you, Dr. Floyd. And your title, please, for the record?
Come off of mute, Caruso.
It's Jennifer Floyd, Mr. Colleen. So I have another item on the agenda. I believe this is for Jennifer Floyd.
You guys are all set.
Oh, I'm sorry, Ms. Caruso. Yeah. Somebody said
Okay.
Jennifer.
I'm here. Okay.
Can we mute everyone, please? We have a lot of background noise.
That's right. Thanks, Rick.
Ms. Floyd, are you able to unmute yourself?
Yes, can everyone hear me now?
Okay. Yeah. Yes,
Oh,
we
you
can
can? Okay,
hear
great.
you. Can you give your name for the record and title, please?
Yes, Dr. Jennifer Floyd. I'm the acting health officer for Wayne County Public Health.
Thank you. If you can tell us a little bit about the first item, the stabilization authority funding.
Yes, this is Kamal Kaprow, the finance director. I can chime in about that one if that's okay.
Thank you.
Yes, this budget instructions about about these funds. Typically, well, not typically, it's called the Essential Local Public Health Service Fund. You may have remembered the name as the ELFIS. We received these funds. I think 1920 was the first year we received these funds, and these funds was to help us offset the budget, meaning you all know about the CPBC, which we get every year, and we have those quarterly adjustments for the CPBC. What ended up happening is that the state got extra
I'm sorry,
money.
can you tell us what the acronym stand for those of us who are?
Oh, ELFIS is the Essential Local Public Health Service Fund, and CPBC is the Comprehensive Plan and Budget. I can type it in. I'll get it to you in a second, but there's no comprehensive budget and plan.
Okay, that's fine.
So that is the basis of our funding, the CPBC. But 2 years ago, the state provided this extra funding, which was, I think the first year was about 800,000. And we were able to add that to the funding in those particular areas. I don't have the sheet that you sent. You see at the bottom of the sheet, we was able to fill the gaps in a few areas. So that's what this funding assisted us with.
Okay.
Through the chair, TR Winter, Assistant Corporation Counsel. This funding is different from regular stabilization funding, is that it was phased in as Kamau said, by statute. And there's a calculation that the state does by that statute and then sends the money specifically for the use of the health department as in the statute.
Okay, any questions from any of the commissioners? All right, we'll move to the next item. Thank you. All right. Madam Clerk.
Item 2, requesting commission approval of a subrecipient award with the Michigan Department of Health and Human Services Home Visiting Unit.
All right, are there any questions? Commissioner Dobb.
Madam Chair, I understand that this grant is to be used for technology to support Healthy Families program. I was just wondering what sort of technology and what it will be used for specifically.
Do we have someone from the administration to talk to this item?
Yes, can everyone hear me?
Yes, we can.
Okay, great. So this one-time award.
I'm sorry, can you tell?
I'm sorry. This is Jennifer Floyd. I'm sorry. This is Jennifer Floyd, acting health officer for Wayne County Public Health.
Thank you.
Sorry. Yeah, this one-time award will be used to support their wraparound services. So as you know, this is a home visiting program. Just to refresh everyone's memory, this is the program we spoke about in the December meeting, and we sent the follow-up information. It's a home visiting program where they focus on families that are at risk for being put into the system. And so these resources include diapering supplies, hygiene supplies, with their tablets, so that when they do the home visiting, they can enter data, things of that nature. So this is a follow-up kind of the discussion we had in December. It's the same program.
Okay, so it's like you said, tablets and things for the people who are visiting the families to enter in data while they're there.
Yes, but also pack and plays. Majority are supplies for wraparound services provided.
Okay, great. Thank you. Thank you, Ms. Floyd, and thank you, Madam Chair.
Thank you, Commissioner Dobb. Any other questions on item 2? All right, Madam Clerk, item 3, can move.
Item 3, requesting commission approval of a local health department grant agreement with the Michigan Department of Environment, Great Lakes and Energy, Drinking Water and Environmental Services Division.
Any questions from commissioners?
Yeah, Madam Chair.
Go right ahead, Vice Chair Colleen.
Thank you, Madam Chair. We've already had the CPBC discussion here earlier. Is this different money than we usually get to keep track of clean water in Wayne County? We get that through the annual CBPC. I forget the acronym totally, from the state. Is this state funding separate from that?
Through the chair, this is Kamau Kaparu, Finance Director. Let me double check that, because I know over the last year or so we've been getting extra funds, and some of them are related to the CPBC. or some of them in separate. So let me look into that and I can get back to you. On
just-
if this is part of the CPBC.
It's Jennifer Floyd again. I can answer that. We do receive this annually. It usually comes pretty late, really about December, but we do receive this annually.
Yeah, we do, through the CPBC is usually where I see it.
I can double check, Commissioner Colleen, just to make sure.
I'll take the extra money for clean water, but I'm just trying to keep track of the bookkeeping for this.
Oh, no worries. I just want to check and look at the list of the CPBC to make sure it's a part of it. That's all.
All right. I appreciate it. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Colleen. Any other, Commissioner Anderson?
Thank you, Madam Chair. I just wondered, this is not really related to this one item, but since I have the folks here from the department, just if we have someone that can answer this question. We received a call in the office about someone that believes and within the building that they live in, senior apartment place, they're concerned about the environmental quality of the air. And I don't know if there's anyone that could just address whether or not the county does anything. I know they monitor outside air quality, but I don't know if they do anything for indoor air quality.
Commissioner Anderson, this is Melita Jordan. I'm the Director for Health, Human and Veteran Services. I don't have a specific answer for you for that particular question, but I will certainly check with the Department of Building and the Department of Public Works to find out, because I think that would be their area also. And so I can certainly reach out to them and find out and get back to you on that.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Anderson. All right. We will move to the next item. Madam Clerk.
Item 4, requesting commission approval of Amendment 1 to a 1-year intergovernmental service provider agreement with 2 1-year options to renew with the Detroit Wayne Integrated Health Network.
All right, are there any questions on this contract?
Can someone just give us a general overall?
Mm-hmm. Sure.
I mean, this is pretty detailed, which is fine,
Mm-hmm.
but someone could just.
Good afternoon.
Mm-hmm.
This is Cecily Hogan. I'm administrator in the Juvenile Youth Service Division in the Department of Health, Human and Veteran Services. And this is an amendment to the IGA that we have with the Detroit Wayne Integrated Health Network to provide funding for mental health services for juveniles who have been diagnosed with serious emotional disorder. And it also provides funds for assessments for the JIF and target case management.
Okay.
Any questions? All right. Next item, Madam Clerk.
Item 5, requesting commission approval of retroactive modification 2 to a 1-year intergovernmental service provider agreement with 2 1-year options to renew with the Detroit Wayne Integrated Health Network.
Right. Any questions? Right. Commissioner Anderson, did you have a question or was your hand still raised from the prior question?
Still there, and I'm just taking it down. Thanks.
Okay. Just wanted to make sure. All right. If there's no questions, this is kind of self-explanatory as well. We'll move to the next item. And actually, yeah, that is the last item. So we will take a motion for recommendation to move this item forward to the full board? Anyone?
I'll recommend to move all these items forward for consideration to the full board.
Is there support?
Support Anderson.
Thank you. It's been moved and supported. All those in favor? Let's do a roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick.
Yes. Are there anyone opposed? All right, motion passed. Next item.
F, such other matters may be properly submitted before the committee.
Yes, I actually would like to have our Health and Human Services Director, Melita Jordan. She has some information that she would like to provide to us. And so go right ahead.
Good afternoon, and
Ms.
thank you,
Jordan.
Madam Chair. My name is Melita Jordan. I'm the Director for the Department of Health, Human and Veteran Services. And I just wanted to bring some information to the Commission to share with you as to where we are in opportunities as it relates to addressing our COVID surge here in Wayne County. As you know, in 2020, as well as in 2021, the federal government through FEMA provided funds to Wayne County to address vaccine awareness, as well as providing vaccinations, and in addition to that, doing testing. And therefore, the funding actually expired in the summer of 2021. So with that being said, most recently on December the 17th, we received word from the federal government through FEMA, letting us know that we had not spent all of the funding that was allocated to us. And therefore, we had an opportunity to submit a proposal to show how we could spend funds, again, in terms of increasing vaccination, recognizing, as you well know, nationally, Michigan was one of the highest states with case counts. And so therefore, the funding was made available for us to be able to address the communities. With that being said, we moved quickly to receive the guidance from FEMA so that we could determine how we could best do that and continue to reach those populations who had not been served and or who had failed to get vaccinated and still wanted to be vaccinated, and recognizing also that we had minimal sites here in terms of testing, and we needed to have additional sites that we could make it accessible for individuals to reach. Therefore, I wrote a concept paper that spoke to how we would do that. And so the staff and I got together over a very short period of time. We was able to write the paper and get it to FEMA, and it was approved. It was submitted on the 29th of December during the Christmas break, as well as learned that on January the 5th that the funding was approved. So with that being said, we were able to think through setting up a hybrid.
Mr. Rashad.
Uh-oh. Did we lose you?
Okay, I'm back.
Go right ahead. Yes, we see you now. Go right ahead.
Right. So with that being said, we were able to set up a hybrid site so that we would be able to provide vaccinations as well as testing, PCR testing and hybrid testing, rapid antigen testing at the same sites, thus allowing individuals not to have to go to several different places in order to get vaccines at one site and testing at another site. So therefore, we would like to we were quickly moving to make all these things happen and wanted to bring to your attention, this was an opportunity for us to move forward on that. So with that being said, I wanted to share what we've done thus far that we needed to bring to the attention of the commission in terms of standing this particular initiative up. we only have a short window, meaning that when we were told about this opportunity, they gave us until March 31st to spend these funds. So with that being said, we quickly moved to get a vendor that would help us with setting up the sites that we need. So we have 5 sites that we're looking at, which has been our highest sites for COVID cases, which is in Dearborn Heights, Livonia, Redford, Taylor, and Westland. Those have been the 5 municipalities that have had the highest COVID cases over time. With that being said, we wanted to, one, have a contractor that would help us in these high need sites. And so therefore, we've identified a communications opportunity with a contractor. And we've also identified a vendor to help us with that. In addition to, we wanted to use our ARPA funding to help us also increase the number of potential antigen home tests that we would have also to make those available as well. And I believe we've had conversations with some of you regarding that also. And that would go through our regular procurement process, but I will say that the other 2 contracts we would like to have immediate consideration. And so therefore we have prepared the required paperwork and the steps that we're going through to get that to the commission, and wanted you to be aware that this would help us continue to do the outreach testing and try to address the issues related to, again, the high numbers that we do have. I will say a week ago, as you know, we had more than 15,000 new cases. And this past week, we've had a slight decrease of 2%, where we now had a 14%, I'm sorry, we had a 14% decrease. We actually have 14,081 new cases this past week. So I wanted to bring that to your attention, in addition to share with you that the Centers for Disease Control has arrived here yesterday, and we will have testing being done at Ford Field starting tomorrow morning at 8 o'clock until 6 o'clock p.m. And they will be doing the PCR testing. It will be a drive-through in the Ford Field Park on the south side of the parking lot. We anticipate that they will be here for at least 2 to 3 weeks. We can provide the phone number in the chat for you as well for people that would like to take advantage of getting tested, and we can provide that information to you also. So I wanted to bring those things to your attention to let you know that would hope that as we get this paperwork through to the commission, that we can get the support to move forward to be able to provide additional testing sites and additional vaccine sites. And I'll take questions.
Thank you, Commissioner. Thank you, Madam Jordan. Let's see, Commissioner Dobb had a question, it looks like.
Yes, thank you, Madam Chair. Director Jordan, I think you listed the communities that are going to be getting the testing sites. Was Canton listed as one of those communities?
We are expanding the sites. Of course, we have a site in Canton. However, we are expanding sites. We're not deleting any sites. We're actually adding more sites. But I did not list, as part of that 5, Canton was not listed. I listed Dearborn, Livonia, Redford, Taylor, and Westland.
Okay.
So your area is not being eliminated, is what I'm saying. We're just expanding the number of sites.
Yeah, I was gonna say, I know Canton's been in the top 3 for quite some time. So, okay, that's all I have. Thank you.
Absolutely.
Thank you, Madam Chair.
Commissioner Anderson.
Thank you, Madam Chair. Ms. Melito, Ms. Director Melito, it's Glenn Anderson. I just wanted to ask you, the companies, there's been, I guess, some companies scamming people into getting a COVID test, and it was even covered on the news, and it's become, I guess, a real problem in different parts of the country. I'm not sure if they came into Michigan or not, but is there something that we're doing to make sure we have legitimate testing sites that I'm sure the ones you would have done the legwork on the companies and investigation of the companies that you're contracting with. But there was one company that was highlighted on television that they were not even processing some of the tests, and some the people never got the results back. And I just wondered if I'm sure you're aware of that, but what we're doing to protect the people that are going looking for a place to get tested, that they will get results in a timely way.
Absolutely, and that's a very good question, and thank you for posing that. So first of all, yes, the company that we have reached out to is part of the state approval process and have been approved by the state, is on their vendor list. And so that we are working again with a reputable company that have previously provided services to the county at one point, but also, like I said, has been vetted through the state for the procurement and has been vetted through our procurement processes as well. Secondly, as I mentioned, the Centers for Disease Control, of course, is here providing testing, and they will be providing results. And you know, they are with the United States and they are reputable, and certainly will be providing the information back in a timely manner to those who come through the drive-through process for that. So we will be making sure that people get their results. There is a form that they will fill out, and they will get an email address or an address and send that information back to individuals in a timely manner.
Just to follow up, could we get a copy of or a list of the names of the companies that are being contracted with? I know we'll get it when we have to approve the contract, but
that's correct. Absolutely.
If you could get something sooner, that would be great.
Absolutely. And there's just one company that we're actually reaching out to help us with that. We're using a number of sites that we have worked with in the past within the communities, so that we're using community facilities as well as senior centers in order to provide the additional testing and the vaccines. We want to make sure that we continue to get our seniors vaccinated as well as get boosted, in addition to working at community-based sites that's within our community. So we only have one vendor that will be helping us, but we need that type of opportunity so that we can move to some of the various sites across Wayne County as well. So they'll be able to help us with that mobility.
Very good. Thank you.
You're welcome.
Thank you. Commissioner Marecki.
Thank you, Madam Chair. Thank you, Director Jordan. What kind of monies are you talking about? Do you know off the top of your head what we have left to spend out of that pot for this?
Yes, I believe at this point, there was 28 million left out of the funding that was provided. And I think my finance director is still on the call. And if I'm incorrect, would you please correct my figure?
No correction needed.
Thank you very much.
Okay, so was this money strictly designated for vaccines and testing?
The money was designated for vaccine testing and to have hire the personnel to be able to do those things in terms of wraparound services, in addition to doing awareness, making sure that we can have an awareness campaign so that people would know the advantages as well as where they could get vaccinated at.
So, so obviously the federal government's not interested in giving any counties money for any kind of therapeutic treatment. We're just, I guess, depending on the hospitals to do all of the therapeutics. If someone needs to go to the hospital. Are there any counties in Michigan that are doing anything with therapeutics with all this money that's been coming in? I mean, I'm sure they wouldn't say to Wayne County, you only can spend it on vaccine and testing, and tell another county they could do other things with it. But are you aware of any other type of programs that this money's been being used for?
No, the guidance is very clear, and it is over a 500-page guidance. I will tell you, I did go through the guidance very carefully so that I could clearly understand, one, what I was writing for and what I would be able to do in a short period of time to reach the population in which it was being targeted for. However, I'm not sure what other counties are actually doing, but you must follow the guidance within the FEMA guidelines. And it was very clear that this is about, one, increasing the number of individuals to be vaccinated, to make it accessible to them, and also to make sure that we can improve awareness, and also to get people boosted where necessary or where available or advisable.
So it's crystal clear then. Okay. All right. Thank you.
You're quite welcome.
Thank you, Commissioner Marecki. The testing and vaccine sites, is this for boosters, or is it any particular vaccine that's at each site, or, okay, but any certain types?
Vaccinations?
Yes, for vaccination.
So it's for primary vaccinations, meaning that if you've never been vaccinated, then again, it would be the primary vaccination, in addition to if a person is coming back after they've had their 2 series to get a booster, then they can be boosted as well. So it will provide vaccinations for those that are eligible, in addition to allowing people to be tested for COVID. That has been one of the challenges, is having enough places for people to get tested.
Yes.
And so therefore, we want to increase the testing sites.
Okay, and there's no cost for either of these?
That's correct. There is no cost at all for any of these services.
Okay, great. All right, well, thank you so much, Director Jordan, for giving us this update and for the insight, because this will move forward once you submit it to our staff for immediate consideration for the full board meeting on next Thursday. So we thank you and appreciate you coming to explain these contracts.
Thank you very much for giving me the opportunity.
Right, Madam Clerk, next item.
Public comments.
All right, we're going to open up the meeting for public comments. We do not reply back to comments, and we're going to give you 2 minutes. So anyone that has a comment, you can raise your hand. All right, looks like Lisa.
How much time, Madam Chair?
2 minutes.
Hi, my name's Lisa Aponoves, and I've called in several times about my daughter who's supposed to be attending Riverview High School. She has a medical mask exemption that has been denied, and they've spoke with the doctor on a Zoom call. I've been sent everywhere from DHS, the nurse there who told me if somebody has breathing issues that they can get a mask exemption, which my daughter does. She had nose surgery. She's having other surgeries. I've contacted Wayne County with no response. I've been told that it goes between the superintendent, the school, and Wayne County. I'm not understanding why this is being denied. The accommodations that they're trying to offer her when she's in special education is not, it doesn't go with her disabilities. She has anxiety, and they're trying to stick her in a class, being the only kid behind plexiglass in the classroom, which is that doesn't go with her anxiety. That's going to put her in a panic attack. So now they want to send her to a pediatrician that the school recommends to see about her anxiety and her ADD and how it affects her in school. I've already had her evaluated. She's had it on her IEP since 2nd grade that she has anxiety and ADD, learning disabilities, breathing issues. Why I'm having to keep supplying them with notes after notes. They met with the doctors on Zoom calls. What they're doing to my daughter, who's not been able to attend 1 day of school this year, is ridiculous. I keep getting passed on from Wayne County to Michigan Department of Education to Wayne RESA to DHHS. Enough's enough. My daughter looks and sees everyone playing sports, sitting in the crowd at her school, none of them with masks on, but she can't attend to go to school and sit in the back of the classroom with no mask. And if she gets up from her desk, she'll put a mask on and in the hallways. Enough's enough. Nobody's standing up for my child. I'm sorry. I'm so upset. How long has this went on? They've had the note before school started, and this all comes down to the superintendent, who is holding a grudge and will not let her go unless she's sitting behind plexiglass. I would like someone from Wayne County to please email me back on what the regulations are for a mask exemption. It's Lisa_Aponoves, APONOVES @yahoo.com. I
Thank
appreciate
you.
Thank you.
Mhm. Is it Contos?
Hi, can you hear me?
Yes, I can. Mhm.
Okay, because you guys are like really far away from me, so I can't hear you really well.
Mhm.
So what I want to talk to you guys about is you're talking about all these vaccine, and you're not talking about therapeutics like someone else had mentioned. Senator Ron John had a COVID-19 second opinion roundtable with a bunch of doctors and nurses actually talking about how the COVID vaccine is causing so many reactions. My question is, why are you guys pushing vaccines so much when you're seeing that there's over 21,000 people have died from this vaccine? So they're even seeing from whistleblowers from the Department of Defense of the medical database has been found that the Defense Department is extracting data where it is decreasing the reactions to the vaccine from 28% to 2%. They are also finding from that DOD that the miscarriage rate is increased 300%, cancer has increased 300%, neurological problems increased 1,000% in 1 year, from 82,000 to 863,000 people in the military. On 9/28/21, Project SALIC, a Defense Department initiative that takes data to the CDC, showed 71% new COVID are from fully vaxxed. 61% of hospitals are fully vaxxed. On that date of 9/28/21, Fauci and the CDC said that the pandemic is of the unvaccinated. You guys are getting skewed data, skewed. You guys are not searching for truth. You're not following your God-given right to look and see. And these are people's lives you're dealing with. And you're not getting therapeutics to the patients early on that the doctors want to give. Dr. Peter Mercala said there's a peak of 18 to 24-year-olds of myocarditis. There's 21,000 cases right now of kids with myocarditis. MRI showing heart damage in 100% of them. Only 32% will not ever go back to normal, their heart. Why are you pushing the vaccines? It's a failed vaccine. Why aren't you talking to your supervisors, to the CDC, to Fauci, and saying, why are you giving us a vaccine that are killing our kids, killing our parents? It's disgusting.
Thank you.
Thank you, but I wish you guys would do something your God-given right.
Right, Billy?
Hi, my name is Billy. I'm from Wayne County. We keep going on about this COVID, but COVID is not what's killing our children. You guys just put out on for the your records from 2020. Homicide in Wayne County. Ages under 1, 4. Ages 1 to 14, 12. Ages 15 to 24, 90 babies died by the streets. Suicide, ages 1 to 14, 5. Suicide, ages 15 to 24, 25. COVID, under 14, 0. For COVID, between ages of 15 to 24 years old, only 4. Only 4. And we got our school mandates on these babies. Why? That's not what's killing our kids. I want this health department to add on this agenda to remove these mask mandates. We have a choice. Top 3 on what your things that came out that are killing children under the age of 25 years old. Unintentional injuries, 149. Heart disease is other is 357. And your number 3 is a heart disease, which killed only 10 people that are under 25. COVID for under 25 years old was 5. What's our real problem here in Wayne County? What's killing our children? Homicide. Homicide. I could not believe 90. Unmask our kids. Give us our medical freedom.
It's time.
Thank you. Christine?
Hi, thank you. Can you hear me?
Yes, we can.
Wonderful. My name's Christine and I have 2 children at Livonia Public Schools. I'm asking for an end to the mask mandates and allow optional masking of students and staff in public schools. The latest information from the state of Michigan as of December 14th shows little difference between districts with full mask mandates versus optional mask wearing. Most infections continue to happen outside of the school. This will not change. I've emailed most of you a link to this report in addition to my letter. What I find most troubling is, again, how many people can mandate and insist on masking children, theirs and others, but who themselves don't wear masks. Just this weekend, I experienced a parent telling me at a sporting event that the kids should probably be masked. I turned around to see this parent sitting within a foot of other parents, all unmasked. Again, over and over again, this virus continues to show as mild in our youths, yet we are forcing them and staff to continue to hide their face. Masking is demoralizing and is a risk to our mental health. One thing that does not need to be proven based on overwhelming data coming from our health professionals is the effect that these past 2 years have had on adolescent mental health. I've also attached an article quoting from USA Today that the American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics and Children's Hospital Association recently declared a national emergency for child and adolescent mental health. The U.S. Surgeon General issued an advisory last month on mental health challenges for children, adolescent, and young adults. Data shows a significant increase in emergency mental health visits and the increase in the severity of those visits during the pandemic. And we're talking about 5-year-olds to 17, 5 to 17. So when can we return to normal? Who do I need to seek permission from? We are at the mercy of a political system that should have nothing to do with our health. The county health department should offer guidance, yet not force their political motivated viewpoints on anyone. One health department says this, another one this. Can't you all see the political motives behind it? I don't want to be a part of it. I don't want my children a part of it. Please allow optional masking. Thank you.
Thank you. Robert.
Good afternoon and Happy New Year. Robert Pulowski here, calling in from Southgate in Wayne County. Just like to piggyback on every other public member that's been speaking today. When can this end? It's 2022. We've been at this since 2020. We're trying to push vaccines, right? The United Kingdom has just ended all mandating of vaccines and masks within their entire country. You know why? Because the Prime Minister got caught. This is not serious anymore. COVID is just another scheme of politics. It has been like this for the last couple of years. It has nothing to do with people's health. It does not help our children. It does not help our families in crisis. It doesn't help any families in crisis. Nobody. This vaccine will just make you sicker and sicker. The science is out there and the numbers are out there. These numbers aren't even accurate. The numbers are tied in with car crash accidents and everything else that goes into each hospital each and every day in our country, including in Wayne County. The numbers are out there. The facts are out there. Look at the right news source. It's pretty self-explanatory. COVID is not a major situation anymore. It is about power. It is about controlling kids. It is about controlling adults. It is about controlling everyone in this country. The president even said it himself. COVID's not a priority anymore. It hasn't been a priority. If we're pushing power on other people, it doesn't do anything. The president doesn't care about COVID, and he hasn't cared about COVID ever since he got into office. Not anybody else on his team. It's all about vaccines. You know, and I look at you and you're getting screwed over by the president and our government. They're not helping you. I'm looking out for your best interests. If he does not care about COVID, don't keep pushing something that he's already given up on. Even if the state, I bet you the state's going to give up on it as soon as we get to summer. You know, I'm looking out for your best interests. And the best thing is, let us have our freedom. If people want to get a vaccine, that is their choice. If people want to wear a mask, that is their choice. Same thing with children. If they want to wear a mask, that they should have that option. I'm looking out for your interest and what's best in the health department. Thank you, and I hope you have a good rest of your day. Take care now.
Thank you. Shannon? Shannon?
Hello, can you hear me?
Yes, we can.
Thank you. Yes, I just wanted to make a comment regarding the vaccine awareness and the testing. I don't feel that that should be pushed on the community. Everybody knows about the vaccine and how to get tested. In fact, if you go get tested, where are the early treatments? You call your doctors and they don't even want to deal with you. They don't want to treat you. And we need to start teaching prevention health and healthy living and early treatment. Also, these masks do not protect the children. The capsule of the virus is an oil capsule, and it's just going right through like you're peeing in a pool. The masks do not protect you. What's going on here is the mental health of our children. In my community, there's 23 referrals for kids with increased anxiety and self-harm. These kids are losing. They are just deteriorating in front of our eyes because of all these mandates, and they think they're going to kill their grandma if they don't wear their mask or get a vaccine. What we're doing to our community, what we're doing to our kids is egregious, and it just angers me that I'm so disappointed with our community, with the health department, that we're just shutting our eyes and not opening our eyes to the bigger picture. It's like insanity. The definition of insanity is doing the same thing over and over and over again for 2 years. Push the vax, get tested. None of this stuff is working. The Omicron, the vaccine is expired. It doesn't even help on Omicron. So this is just needs to stop. The masks need to come off. You need to listen to the Senate hearing testimony on these doctors and open your eyes.
Thank you. Renee?
Hi, my name's Renee. I'm from Wayne Westland. I have 2 sons in high school, and I'd like to start by saying I was looking forward to response from Commissioner Anderson, but with a blocked email address and no response to my Facebook message, I'll bring my discussion here. Reports are not coming out that the masks our kids have been forced to wear for 2 years are nothing more than facial decorations. This mask mandate has caused many of our kids to have depression, anxiety, and some are even afraid to be in public. It's time now for you to stop the mask mandate. With a less than 1% death rate, parents should be able to choose if they want their kids to wear masks. You're completely overstepping your authority. Wake up, Wayne County. Our kids are not responsible for making you feel safe. Thank you.
Thank you. Tamara?
Can you hear me?
Yes.
Great, thank you. Thank you, everybody, for what you do, and thank you for the time to speak. Rather than piling on to everything that everybody else just said, I just wanted to pass along some feedback around, as you're looking for a new public health officer, to really look at and consider somebody who's going to look at the whole health of our community, not just certain things. And in particular with our kids, you know, you just heard countless statistics around, you know, what's happening with our kids, their mental health, their learning loss, drug abuse, murder, et cetera, et cetera. These are all real statistics that we got from your own information. But if that's not enough, think of the financial burdens that these kids will have on our community going forward. So increased strains on youth delinquency programs, the mortuary, you know, criminal system, our prisons. These are not what we want for our kids. And I'm sure this is not what you guys want for the kids either. So please start thinking about the whole health of our community and in particular our kids, because they really all of our future. It's not just our kids, it's all of our kids. Thank you.
Thank you. All right, Madam Clerk, were there any emails?
Yes, there is one email.
Okay, if you can read the email, thank you.
This is from Bridget Brinsky. It says, as to the mask mandate that is still in place, our county is one of very few that still have these unconstitutional and unscientific mandates. For God's sake, everyone knows these masks do not stop the spread. Do you honestly think we are ignorant to the facts? We all know this is not about health anymore, because if it was, you all would be concerned with all the negative side effects that these mandates have and continue to have on our children. Time to follow the real science and get these masks off our innocent children. Stop pretending it's their burden, and it's not, and never has been their burden. Stop the lies and political clown show. Shame on anyone not standing up for our children. You all be judged one day.
All right. Is there any other? That was the only one, right?
Yes.
Okay. Then we will move to the next item. Thank you. Oh, I'm sorry. Did Ms. Jordan, did you want to say something?
No.
Okay.
Madam Chair, I had an update for Commissioner Colleen question. This is Kamal Keperu, Finance Director for the Department of Health, Human and Veteran Services.
Yes, go right ahead.
Commissioner Colleen asked about the grant. It's called the Eagle Grant, and it is not a part of the CPBC.
Okay.
It's a separate mini grant.
Thank you, Mr. Caparu. Colleen.
Yes, sir.
All right, thank you. Next item, Madam Clerk.
Adjournment.
Move to adjourn.
Their support.
Colleen supports it.
All right. Well, everyone, meeting's adjourned, and everyone have a good rest of your day. Thank you.
Thank you, Madam Chair.
Bye-bye.